introduce the title of the talk, which is a novel approach to pain management in the shelter. And it'll be focused on a product that's just come onto the market here in the US called Recuvyra. And I'm just interested in a show of hands if anyone has heard of this product or used it. Okay, so maybe 20% of you, 15% of you. So for those of us who work in shelters, we recognize that pain management can be very difficult, right? And particularly so in a shelter for dogs that just recently underwent a surgical procedure. Because in shelters, we often have limited financial resources. We often don't have we have financial constraints, so we might not be able to afford that latest and greatest drug that we might want to use. We also have limited staffing constraints, right? Because we might not have staff that are available to medicate dogs 2 and 3 times a day for several days on end for orthopedic or other soft tissue procedures that we might do in-house. And a lot of our patients also go home on the day of surgery or the day of adoption or shortly thereafter, and so it can be difficult to manage their post-operative pain once they leave our facility. And similar to most clients, adopters are a unique subset of the population too, because they don't necessarily have that bond yet with that animal, and so sending drugs home and ensuring compliance, if they're going to administer the pain management appropriately, is questionable. So when we start to think about what does the ideal pain management drug for a shelter look like, it would look something like this. It would probably be non-invasive. A topical would be nice, or maybe an oral drug that's easily eaten up by our dogs and cats. It would probably only be dosed one time. We would go ahead and apply it, and then we'd let it be. It would be convenient. It would be cheap, ideally, right? And it would also be safe for everyone involved, for the patient, for the adopter, for our shelter staff. So recently introduced onto the market is this product called Recuvyra, and it's manufactured by the company called Elanco. And it is a topical product that's applied and provides 4 days of analgesia for our postoperative surgical patients. And it was introduced onto the market in Europe a little over a year ago. And then earlier this year, it hit the market in the US, but it was only used in or only marketed to specialty hospitals and academic institutions. And recently, a couple months back, it was now introduced to private practitioners and shelter veterinarians. So Recuvyra is a small volume, rapidly drying topical that's applied between the shoulders between 2 and 4 hours prior to surgery. It provides 4 days of opioid pain control, and it's the first transdermal solution for dogs to be used for postoperative pain. And many of you might have heard of fentanyl patches used in dogs, and certainly those are still used as well. So you can start thinking about, and we can talk later about how this product compares to fentanyl patches. This graph shows the average plasma concentration after topical administration in a dog over 4 days. The area that's shaded, I hope you can see that there, the area that's shaded is the average plasma concentration over 4 days in 90% of dogs. And we can see that with a continuous delivery system, so we topically apply this product, we allow the stratum corneum to absorb it, and then it's continually released over these 4 days. And so what that means is that we can circumvent the peaks and troughs that we see typically with products that have to be administered several times over the course of 4 days. In order to ensure proper use and compliance of this product, veterinarians do have to undergo a mandatory Elanco-sponsored training program online. It's fairly straightforward and easy to complete. It takes about 20 minutes. Once the veterinarian takes this course and passes it, they are then authorized to go ahead and order the product for their facility. It is then the veterinarian's job and responsibility to train the rest of their staff into the proper handling of this product, because there are certain nuances and cautions that need to be followed when using this product. So it's fairly straightforward to use. The product comes in 10 ml vials, and it also comes with specialized syringes that must be used with the product, as well as a product applicator tip and a needleless adapter system. The person applying the drug, as well as the restrainer, must wear impermeable gloves. And these can be either latex or nitrile, but this really is crucial. This product is not topically absorbed through human skin. So that's the difference, right, between our fentanyl patches, which can be taken up because those are a human product, and this is a veterinary-specific product. But nonetheless, it can be absorbed through mucous membranes and eyes. So we'll talk about this a little bit later too, but it's very crucial that a minimum of 2 people are there when you apply this drug to ensure compliance with these guidelines, and that they wear gloves. Outerwear, including a smock or a gown, and eyewear is also recommended. There's a foil that goes around the bottle, so one would go ahead and peel that back, go ahead and take the plastic top off the vial, insert the needleless adapter system. This product is good for 30 days after opening, and that needleless adapter system stays on the vial until it's discarded. Then go ahead and use your specialized syringe, invert the bottle, and go ahead and withdraw the amount of drug you desire. There's then a special applicator tip that you put on the syringe to go ahead and apply that drug. And then it's applied in the same area as you would Advantage Multi or Frontline. But one thing that's different about this product is that unlike Frontline or Advantage Multi that leaves a greasy or oily topical residue, this product does not. So this product dries fairly quickly, and so you can't necessarily tell. And this becomes important because this product can still be taken up by the human mucous membranes and transferred onto human skin within 72 hours. And so it's really important that you note that an animal had this product applied and that we avoid that contact site for those 72 hours. This is an up-close picture of the applicator tip. The area of the dermis where this product is applied doesn't need any special application or any special preparation, such as clipping. So you might be wondering what the cost of this medication is. A vial, which is 10 mils, is $300, and certainly that seems pricey. The average dose for a 30-pound dog, 30 to 40-pound dog, is 1 mil. So when you divide that out, that's about $30 a dose. But mind you, that provides 4 days of opioid-level pain control. And so if you have a facility where maybe you're doing orthopedic procedures or other painful ancillary procedures like removing bladder stones, then when you calculate the staff time that's associated with repeatedly administering these drugs over time, as well as the cost of the drug itself, it might behoove you to actually do that calculation to see if this might be a product that would work in your facility. There's a lot of studies that have been published in the last few years on this type of product, and if you do a Google search for transdermal fentanyl solutions or gels in veterinary medicine, you'll come up with a lot of them. And this is one study that was published in the Journal of Veterinary Pharmacology and Therapeutics that actually looked at, it was a comparison of using this fentanyl gel system versus repeatedly administering buprenorphine, which probably a lot of us do in our facility, and it actually found better pain control when using the transdermal fentanyl gel. And the researchers concluded that this might represent a novel modality for the postoperative pain management of our surgical patients in shelters. Again, there are certain caveats when we're using this product, though, that can't be ignored. The topical fentanyl transdermal solution should not come into contact with mucous membranes or eyes because it is rapidly absorbed. And so this is it's a very huge issue for children in particular. So Elanco recognizes that this is an issue for our juvenile population, and so they recommend that children do not come in contact with an animal that has had this applied within 72 hours after application. Dogs also, again, need to be restrained for a full 2 minutes to allow this product to dry. So what are the potential drawbacks? So certainly there are, a lot of pros for this product, right? I mean, it sounds great. It's topically applied. It's fairly safe in our canine patients. It's, not that expensive. It might be in our financial grasp depending on your facility. But there is huge abuse and misuse potential. So this product is 1,000 times more potent than the human-approved injectable fentanyl. So just to give you an idea, the human injectable fentanyl concentration comes at a concentration of 50 micrograms per mil. This product, 50 milligrams per mil. So what does that mean in your facility? That means that if this product was topically applied to a dog, and you had, a rogue staff member or maybe prison staff, someone in your facility that wanted to abuse this drug, they could find a dog that had this applied within 72 hours and harvest it from the skin site and then touch their mucous membranes. So there has to be some way to, have clear signage that an animal had this applied and that there's certain precautionary measures. And have to be thinking about, if we are working in a facility where dogs are going home on the same day, really counseling those owners. That's huge. There's potential side effects like any opioids in dogs, GI hypomotility being one, hypothermia during surgery. Remember, this product is administered, it's applied pre-operatively. So dogs can become hypothermic or have prolonged sedation post-operatively. It also has a minimum age and weight of 6 months and 6 pounds. And it does have fairly limited versatility, right? It is dose per pound, and it says on the box what the dose is per pound, which is nice, right? Because we can tailor our dose a little bit because it's per pound, unlike our fentanyl patches where we don't really know, what the appropriate size patch is. We only have general recommendations, but we can't use this product in cats, and we do have to really abide by the guidelines that are on the product label. So can this product be used in your shelter? I think there's a few questions that you have to ask yourself in order to consider whether or not this product might be a good fit for you. 1, does your shelter have the necessary staffing capacity? Again, you need 2 people to administer this drug. So if you have staff running around all day and there's never 2 people convening at once, this might be an issue for you. So you have to have the staff time where somebody can actually physically hold a dog for 2 to 5 minutes to allow this product to dry. 2, can your shelter adhere to the necessary PPE protocol? So again, if you have shelter staff that may or may not wear gloves, may or may not wear the proper eye protection wear, then we probably don't want to be using this product. Do your dogs go home within 72 hours of surgery, which so many of our patients do, right? They're maybe sterilized on the day of surgery or shortly after, and then they go home. Sterilized the day of adoption. So if your dogs are going home with potential adopters, you either have to have a very strong release and time to really communicate the dangers of sending a dog home with this drug, particularly in a home that has children, or you don't use it at all in these types of situations. Also, can your shelter manage opioid-related complications? So these are rare. In the field trial studies, less than 2% of dogs needed to be reversed with naloxone, but they do happen, and so this prolonged sedation after surgery can be an issue too if you're doing high volumes of animals and you have to wait for them to recover. That can be tricky as well. And also, what is your anesthetic monitoring capacity? If you are in a facility where you're struggling to keep up monitoring your pulse oximetry, things like that, these patients really need close monitoring because they are under the influence of opioids. So take-home points is that Recuvyra might have a place in a high-quality shelter that performs potentially orthopedic or other painful ancillary procedures, probably doesn't have a place for just your routine spay-neuter surgeries, and it shouldn't probably be used in facilities where animals leave the day of adoption or surgery. If you're interested in adding this product to your preoperative pain management portfolio, you can contact Elanco at elanco.com, or you can just go to the recuvyratraining.com site and take the course for free at that site. These are my references, and we'll take questions at the end, I guess.